If your tummy's a little bloated, or maybe you find you feel full quickly, or you have no appetite whatsoever, having to go to the bathroom more often, that doesn't really sound like severe symptoms of something, right? Seems kind of par for the course. I think many people wouldn't think twice about them. And what a whole lot of women don't recognize is that all of those happen to be symptoms of ovarian cancer. And it makes it a very difficult cancer to detect early because of that. In a moment, we're going to speak to an ovarian cancer survivor, but first we want to speak to Dr. Lucy Gilbert, who is the Director of the Division of Gynecologic Oncology and the Women's Health Research Unit at the McGill University Health Center. Thank you for your time, Dr. Gilbert.
Hi, thank you for having me.
So every time we speak, I like to brag right out of the gate that Dr. Gilbert was my specialist, and I wish everyone could, I know, every time, right, Lucy? I can't help myself. I wish everyone had you as a doctor. You are world-renowned for a reason. Dr. Gilbert, I would assume that early detection would be crucial with any cancer, but why is that even more so the case with ovarian cancer?
You hit the nail on the head. Early detection is necessary. If you want to cure any cancer, you have to detect it early. It's important for ovarian cancer because we have not been able to detect it early. For 30 years, the death rates from ovarian cancer has not budged because we are diagnosing it too late. And now we have a test. At last, I've been working on this test for 8 years. Now we have a test that's ready to be offered as a clinical trial, and it's a DOvEEgene test.
Okay, so tell us how it works, because this test literally could change everything having to do with the early detection with ovarian cancer.
Absolutely.
It's called the DOvEE test, right? Okay, tell us about it.
So this is a genomic pap test. This is such a vicious, cunning cancer that it spreads like icing sugar over the abdomen before it can be detected by scan or a blood test. So that's why we need a genomic pap test to pick up the mutations very early before the cancer has a chance to spread. So the standard pap test won't do it, and that's why it's a genomic pap test. And we are in the final leg of the clinical, ready to offer it as a clinical trial, so that we can get this test out to doctors' offices all over Quebec and Canada, so that women can have this test every year or two, just as they do with the standard pap test, and no more deaths from this cancer, no more suffering from this cancer.
So this will save lives, and like you said, it'll just be standard, like you get a pap test, you get a DOvEE test at the same time.
Just like mammogram, pap test for men, PSA, you get this DOvEE test. But this test, we have the 6.2. We are just short of $500,000 to get the $6.24 million to complete this clinical trials. And we are there. Nowhere in the world is this test available. And it's available. It'll be available in Montreal, and we need everybody's help to raise the final 500.
Made in Montreal. Okay, so that's where this campaign comes in, right? Text
Yes.
Julie. Okay,
Yes.
do you want to tell us a little bit about that, Dr. Gilbert?
Yes. So we have partnered with the Quebec media personality Julie Snyder, because she lost her mother to ovarian cancer. So Julie's helping us raise this. So if you can text Julie to 41010, or go onto the website www.dreambigwithjulie.ca, because we've called this campaign No More Women Lost, because we are sick and tired of the deaths and sufferings caused by this. It's the fourth highest cause of cancer deaths in Canadian women, and I think it's shameful, and we have to change it.
Well, and it's on the cusp of changing. That's what's so exciting. So again, if you text Julie to 41010 to donate $25, it comes off your phone bill. No need for credit card information. The website is dreambigwithjulie.ca. I want to bring in Joanne Photiades, who is an ovarian cancer survivor. Joanne, you're on the line.
Hi.
Hi, Joanne. Tell us a little bit about your experience.
My experience...
when did you get diagnosed with ovarian cancer?
I was diagnosed in June 2015. It started off with those exact minor symptoms that you were talking about earlier that get easily dismissed. So I had some sharp pain. I would get full quickly when I would eat. I would have to go to the bathroom more often, but all like really minor. You wouldn't think twice about symptoms, but when you put them all together, you get concerned.
And so you put those symptoms together, you thought I better get this checked out. How did you find out that you had ovarian cancer?
The first thing I did is I had blood tests, and the blood test showed that everything was normal. And because we were trying to get pregnant at the time, I had an ultrasound scheduled, and so they told me at the time that, well, did you know you have a cyst growing on your ovary? And actually, it's a little more than small. It's about 10 by 12 centimeters. You might want to have a look at it. So Joanne, I took that information, and I went to see another doctor right away.
You must have been terrified.
I was terrified. That's an understatement.
Yeah, I bet. And then, we're talking about early detection. Where were things for you, and what kind of treatment did you have to undergo?
Because I listened to my body and listened to all of those symptoms, had I dismissed them earlier, and had we not been trying to get pregnant, I don't think I would have seen a doctor so quickly. Honestly, I would have dismissed those symptoms and said they come and go. There's a lot going on. There's stress. There's so many things. But because I listened to my body and went to see a doctor, I got the early diagnosis. So it was phase 1A.
Oh, good.
So the best kind to get, if you could call it that. So I had surgery, and I had a few surgeries, and then I had a complete hysterectomy.
Can I just ask a question? I'm listening to you tell your story, Joanne, and I'm trying to understand, first of all, what you mentioned. You took a blood test, and the blood test showed nothing abnormal.
That's right.
That's scary in and of itself. I thought that was your first marker to give you an idea if you had some kind of a cancer.
Well, it depends if the doctor is looking for those cancer antigens or the tumor markers, right? But when you go in with those mild symptoms, they're not thinking cancer, especially when you're young. They put you in that box that you're not high risk. And if there's one thing I could get people to take away from this conversation is that nobody is immune, and cancer is random. And yes, it can happen to you. It won't always happen to the neighbor. So always listen to your body and always check.
And then the second part of this, as you're telling the story, is you said, given the fact you were trying to get pregnant, perhaps that's the reason you went sooner rather than later. Had you waited longer, how much different a diagnosis would it have been?
Honestly, that's impossible to determine. I think given the rate it was growing, it grew from 10 by 12 to 18 by 20 centimeters in less than 3 weeks. I think had I waited another couple of months, it would have probably been a phase 3 diagnosis, and then the outcomes would have been 10 to 30% in 5 years versus an 80% cure rate that I got it in the phase 1.
Okay.
I'm thinking, Joanne, about how, it's a weird thing to say that you got lucky, but, in a strange way, you got lucky.
Yeah.
Now that
I did.
it's funny to say it though, isn't it? And now that this test is being developed by Dr. Gilbert, the DOvEE test, and it's going to kind of take luck out of it for other women, that the test will help detect early. How do you feel knowing that that's on the horizon for other women?
Oh, honestly, I'm just so overwhelmed with gratitude because luck shouldn't be a factor in deciding what happens with your life.
Excellent. So that was just so perfectly well put.
Yeah.
So I'm going to once again give out that information. Thank you for sharing your story, Joanne. The campaign is Julie. You text Julie to 41010 to donate $25. Again, the website to make a donation is dreambigwithjulie.ca. Thanks for sharing your story, Joanne.
Thanks for having me.
There you go,
and
Joanne Photiades.
Yeah, and a big thanks to Joanne Photiades is an ovarian cancer survivor. Big thanks to Dr. Lucy Gilbert as well, Director of the Division of Gynecologic Oncology and the Women's Health Research Unit at McGill University. They are doing amazing work.
I hear stories like that, and I think when someone says that, listen to your body, we so often tend to ignore signals, think, oh, that's nothing, it'll pass. You know what? Time, as you just found out in that interview, is of the essence, right? You don't even want to think about what would have happened had she waited even longer. So I'm not giving you medical advice. I'm just saying, listen to your body. Don't ignore what your body is trying to tell you. If it turns out to be nothing, great. But if it doesn't, at least you paid enough attention. And in her case, she's the survivor and she's here today.
And I love that message going forward, that luck should have nothing to do with it. And the DOvEE test is going to take that aspect out of it. That it'll be just like getting a PAP. It's just par for the course.